and he hadn't for months and months and months. So they just didn't know what the reason was. So they brought him in, and in usual fashion in the emergency room, they do their full workup. They did an X-ray for whatever reason. Actually, I think they did a chest X-ray to start with, and the first thing they see is something up here. So then they focused in on the X-ray here, and it was his dentures. So the dentures got caught in there. Hey guys, Dr. Undavia, Dr. Reddy, Dr. Smith from NJENT Facial Plastic Surgery. We wanted to bring you a short video today about the craziest things that we've taken out of the ear, nose, and throat. Foreign bodies. Sometimes they're in the emergency room, sometimes they're here, sometimes they're in the operating room. So I'm going to start first with the throat. This is a patient who unfortunately was demented. He had been tolerating things by mouth and throat at the nursing home for a few months, but slowly over the past couple months, the amount of food and amount of liquids that he was tolerating, it slowly declined. And about a week before he got admitted to the hospital, all he could have was very little sips of water. And he wasn't communicating with anybody, and he hadn't for months and months and months. So they just didn't know what the reason was. So they brought him in, and in usual fashion in the emergency room, they do their full workup. They did an X-ray for whatever reason. Actually, I think they did a chest X-ray to start with, and the first thing they see is something up here. So then they focused in on the X-ray here, and it was his dentures. So the dentures got caught in there. So I got a phone call from the GI doc who first tried to go in there and take it out and said the dentures are stuck. So we took him to the operating room. We could not get a breathing tube in because the dentures had been in there for months. Once we found out after asking how long the dentures had been missing, it had been months. And the dentures, they have like these little metal prongs. They had integrated into the arytenoids, into the voice box, and they were now there. And so I tried for, it must have been an hour and a half to 2 hours of trying to get it out through the mouth, and we couldn't do it. So I had to transfer him, and he had to have something called a partial laryngectomy. He had to have part of his voice box removed just to get this foreign body out.
Wow. I've done dentures, but only a partial denture. And it was immediate, not that long.
It was insane. And then the guy was cachectic. He literally had lost so much weight. That was a crazy story.
That is crazy.
Dr. Reddy?
So for the ears, this is something that you guys have all seen, but not maybe super crazy for us, but probably crazy for our listeners. But I had a patient where, she went to sleep one night, and then the next morning she woke up with a weird sensation in her ear, and she felt like a fluttering sensation sometimes in her ear, and sometimes like these little sharp bouts of pain. And so she came in, we took a look in the ear, and there was a cockroach. So at first she said that there wasn't any cockroaches in the apartment. So the way we got the cockroach out was it was stuck in there pretty good. It was pretty big size because cockroaches can kind of like squeeze themselves into tight openings and kind of get in there. And so the first step was just killing the cockroach.
How did you do that?
So we put some topical lidocaine medication in there, and basically the cockroach just dies, and then we just kind of have to remove it piecemeal, which is kind of gross.
I've had a couple of those too.
Yeah, not fun.
No, bees are bad too. I've had a little kid with a yellow jacket in their ear in the ER. That was also not fun. Insects tend to like fall apart when you try to grab them out of there. But same thing, drowned it with viscous lidocaine and then took it out afterwards.
We on a forum of ours, we have one doc posted that he had a brown recluse spider in the ear, and it had created a web and everything. So when he looked in, he saw the spider on the web in there, and he knew it was a brown one. I would not know that it was a brown recluse. I would just run. sorry. All of the patients watching and listening, I'm sorry.
I think the craziest thing that I've ever gotten out of an ear was something we couldn't see what it was, and then after I grabbed it, pulled it out, it was one of those little googly eyes like that you would stick like on a craft project.
Yeah.
And it was like I flipped it over and looked at it, and it was like an eye. Yeah. Kids often are responsible for a lot of crazy foreign bodies.
Yep.
I think the craziest or the weirdest thing I took out of someone's nose, I think we've actually had a couple patients that have had a couple weird things in the nose, but a Lego head. I had a kid that shoved a Lego head and got that stuck up between the turbinates in the nose, and that was a little bit difficult to get out.
I had a 4-year-old that put batteries in her nose, but she put 2, one on each side, and it was a horrible mess. She ended up having a septal perforation. And you can't reconstruct that at 4, so she just has no septum inside of her nose. I'm sure it bleeds and crusts and hurts. I felt terrible for her. Those are emergencies.
So foreign bodies that are emergencies are typically
batteries.
Button disc batteries. So those are why there's all those labels and stickers on all those button and disc batteries that prevent. It can happen in the ear, in the throat, in the nose, but in any of those locations, it's absolutely a medical emergency to get those out ASAP. So
including hearing aid
batteries.
Absolutely common.
Yep, absolutely. We tend to see a ton of hearing aid parts in the ear all day, whether it's the earpiece that goes in, the rubber stuff, the battery.
Yeah, the most common foreign body we probably see are Q-tips.
Yeah.
Yep.
The heads of a Q-tip.
So the craziest foreign body I think we've taken out from a nose. I think you had one and I had one, and you may have had one at some point, but a tooth in the nose. Finding a tooth inside the nasal cavity is something that you don't typically think of finding, but
I have a video I can use for TikTok.
I think there's a couple of times every once in a while you get some abnormal growth in the nose that ends up being like a tooth or.
Anyways, this is a short segment. We just wanted to show you some of the crazy stuff we brought. Don't put anything in your ear, nose, or throat, ever, especially Q-tips. Follow us for more content.
Nothing smaller than your elbow.